Sorry.
What's up, y'all? It's Dr. Mia and Joseph at Me Bella Wellness Center, where we offer gynecology, weight management, hormone pellet therapy, intimacy services, laser hair removal, and total wellness with supplements. Our goal is to help you live well, age well, and experience everlasting intimacy. And welcome to Ageless Intimacy with Dr. Mia and Joseph. You want to introduce yourself, sweetie?
Didn't you just introduce me?
Mm-mm,
All right. Well, I'm Joseph. Me Bella Wellness Center, Men's Intimacy and Health Coach. How y'all doing? Can y'all hear us? Anyway, let's go. All right. So today we're talking about exercise and intimacy, and how exercise can help you with your intimacy. Overall, exercise is a part of being healthy. It's not the end all be all, but it is a part of being healthy. I know when you're younger, you can exercise and eat anything you want to eat. But when you get older, that is not the case.
Not an option.
No, it's not an option, but exercise actually absolutely helps with your intimacy as you get older. And it is just, we're going to talk about just a part of being healthy, which is exercise.
Mm-hmm.
So,
and the reason we would like to talk about exercise and intimacy is because, as we always stress, it's important to want to have and to be able to have everlasting intimacy, meaning as you continue to mature in age and go through this midlife journey, you can still always enjoy great intimacy with your partner. So in order to do that, it's that whole wellness approach and lifestyle approach. And wellness is a lifestyle. So a component of that should be exercise just as much as it should be your prevention and screening, and you're eating healthy and monitoring your weight and making sure you're drinking half your weight in ounces of water and staying active in general, doing a certain number of steps a day, but also that intentional exercise. So not counting because you are a nurse and you walk the floors a lot, or whatever your job is, you're up and down, but actually putting time in for some intentional exercise to help with resistance training, to help your muscles as well as your bones.
Right. So how does that help your intimacy though? Because we talk about being healthy and all.
So blood flow.
But I got some more.
Okay.
So we talk about being healthy, working out, eating right, but we don't usually tie in how working out and ties into your intimacy.
Right. We do not. So I think it ties into your intimacy, one, for flexibility. So usually when you exercise, you're going to do more stretching. You're going to actually be strengthening your muscles, and you need to always stretch them out. So a part of your exercise should definitely be stretching. And with stretching helps with flexibility, and flexibility helps with physical intimacy so that it can be as enjoyable as you want it to be, and you can be as creative as you want to be. But flexibility requires some exercise and some stretching and some practice.
Mm-hmm. Absolutely. But how does that help your intimacy though? I get the flexibility,
the
blood flow, but what is
the healthy living? So the whole lifestyle component and being healthier because you're exercising, the increased blood flow to the genital areas, and more blood flow, the better things work for women. It helps with lubrication and sensitivity. For men, that helps with longer, stronger, more significant erections, more like they were when they're in their 30s. Where they're hard and firm and they can still get them on demand. So all of those things are important, and exercise plays a huge role in that whole component, because it also helps with the weight management component. And with healthier weight, that decreases the risk of chronic diseases that actually affect blood flow. So if you maintain a healthy weight, you're less likely to get diabetes, you're less likely to get high blood pressure, you're less likely to get cancer. So many different diseases that affect us we can prevent with a healthy lifestyle and healthy weight, which includes exercise.
Okay. So we're talking about intimacy and exercising, and how it helps your intimacy. And I think one thing we said was blood flow and flexibility are the two key components, not the key components, but two of the key components to
and muscle mass and bone,
increasing your intimacy.
Right. And you need the muscle mass for the strength. You know what I mean? So you need muscle mass for the flexibility and the strength.
Yeah, some people don't have any muscle mass. They just slim.
Right. But I'm saying, but exercising helps you to hold on to what you have. Right. Some people are slimmer, but as you get older, you naturally lose muscle. Mm-hmm. So if you're not doing something intentional to increase your muscle with resistance training, plus the exercise helps with your bones, you're less likely to get a fracture. Once you get a fracture, that can limit your physical intimacy just because of pain. And also exercise regularly helps to decrease the chance of you having chronic back pain and all of the other joint issues, which can negatively affect your quality of life, as well as your intimacy if you're in a whole bunch of pain or you get a fracture.
Right. All right. So I'm going to take a pivot.
Okay, let's pivot.
Okay. Because I know we're talking about exercise. But what about the cardio part of exercising? Mm-hmm. Does that help with your stamina, your endurance?
Yeah,
because you can exercise and not have any endurance or stamina.
Right, especially if you're walking really slowly, not getting your heart rate up. So I think it is important to have that cardiovascular activity, and you can use them together. Mm-hmm. So that's what I do in my exercise. I do resistance training, but I'm also doing an increase in my heart rate by doing things to get my heart rate up throughout that 30 or 45 minutes of exercise, and really starting with my Peloton or, walking or some kind of cardio activity. I think that's better for my resistance training, my fat burning, but also, like you said, for your stamina, your breathing, your endurance, being able to, maintain your breath longer, like all of those things will intensify and improve physical intimacy because they allow you to participate
when I work out, I don't take a break. Like, I take a break, but it's not like
to get your heart rate down.
Yeah, I don't take a break. It's like a 30-second break, and that's between 3 sets of 3 different rotations.
And you still may not be sitting still.
No, I'm not sitting still. I'm not. I'm literally probably going to the next rack or whatever, or putting a weight on the rack or something. And I'm controlling my breathing during that time too. But I don't take a break. It keeps my heart rate where I need it for at least 30 to 45 minutes.
Right.
Okay, so we're talking about exercising and intimacy and how exercise plays a role in your intimacy.
And exercise protects your heart. If you're doing the right exercise for you, you're also protecting your heart, and it helps with your heart. And then being able to have good stamina, endurance allows you to be able to have intimacy for longer and to stay healthier for longer.
Right. And we're going to talk about this on the podcast so we can
really talk about it.
Yeah, we can. Because I'm limiting what I'm saying right now because we're on Facebook. Mm-hmm. So you exercise 4 days a week. I exercise 4 days a month. And, we've been pretty good about our weight management. But we are going to pivot a little bit here and talk about a little bit about food and exercise, because the one thing we've realized, especially I myself in the last 2 weeks, and I give a short story, we don't eat a lot of fast food. We do eat some food out, but it's not a lot of fast food like McDonald's, Burger King. And I ate some McDonald's about 2.5 weeks ago, and I'm just now recovering from the McDonald's that I ate 2.5 weeks ago. It was the best sandwich I've had in my life from a fast food. And the next day I took a total left. Like, it was all bad. Hiccups for 3 days, strong cough, indigestion, reflux, you name it. Anything that had to do with my digestive system, it was going down.
And we actually went through to figure out what it was, because we had been eating a lot of the same stuff. So I was like, well, that shouldn't have made you sick. And then he had to think back, because I think in his mind, he tried to forget that he had the McDonald's, because he never mentioned that to me.
Yeah.
So then he was like,
it was the best. No. I didn't say the place. She said the place. But it was the best. The best. And
fast food,
God, it was the best.
Yeah, not to put any shade on them, just saying that as you get older and mature and you start eating.
And we don't eat fast food a lot. Like, we will eat out, but it's not usually like fast food, which which if in theory is all fast food.
Mm-hmm.
Okay, because a lot of times they come from the exact same place. They just
mm-hmm.
deliver, and the packaging is different.
Right.
So that being said, I really think that if I didn't have my weight under control, and if I wasn't in semi good shape, I think I still would be feeling the after effects of eating that food.
Or think about it, if you
because I still had to function. I still functioned while doing all this.
Right.
But it was, I mean, I think most of it was because my weight is under control. If I was 255 pounds, I think right now I still would be feeling pretty horrible.
And I think
that was bad.
Right.
For about 2 weeks.
And I think too, it goes to show how bad you would feel had you not changed your lifestyle and changed your ways, and we were continuing to eat the food. You eating like that all the time, so it becomes a habit that you don't feel good all the time, that you're tired all the time, that you drag, and that you have a bad reflux all the time, that you get the hiccups and you burping all the time, and you have gas all the time, and your GI tract. It just becomes a normal habit. I mean, a normal way of life. Yeah, but it's not. But where we notice is that when we eat healthier, we choose healthier foods, we decrease the processed foods and the sugar in our diet, is we feel better. Right. Our energy is better. Even if we get in the pellet, if we're eating terrible, we still not going to get the best out of our balanced hormones if we're putting the wrong foods in our mouth.
So, and that being said, because of that, I had no energy to get up and go work out and exercise.
Yeah.
Because I was spending time, I was waking up in the middle of the night, coughing real hard behind a reflux, and it all had everything to do with what I was eating. So let's be careful about what we're putting in our bodies if we're going to work out and try to get the best out of our bodies. Mm-hmm. Because I didn't work out. I didn't work out at all in that period, and I had every intentions. Like, I woke up some mornings right on time to work out, and I just was like, I don't have it. I just don't have it to work out. And it was all because I was going through this internal digestive thing behind what I ate. So let's be careful about what we eat, because I didn't mess with my intimacy though. I still was down. I was still down.
And intimacy, dog, I keep forgetting what I'm going to say because let me see. I was about to say something. Dang, it was good too. Okay, I'll think of it in a minute. Dang, it was so all right, good.
So while you think of it, all right, so we're talking about exercise and intimacy. So what would be some of the things that you would do as a woman to improve the blood flow? What's some things that you would incorporate in your exercise that would improve the blood flow in the women area?
Yeah, so some of the exercises would be pelvic floor muscle exercises. So
like what do they call
we'll let Peggy tell them exactly what it is, but I know but even squats, even squats, even building up all of your muscles around your pelvic floor, making sure you're able to do the Kegel exercises, making sure you're able to do the squats, making sure you know how to do the right floor exercises to help build up those muscles, because that's going to help with your function. That's going to help you have better muscle control yourself, so that you can control some of the enjoyment that you receive. And it's going to increase blood flow in that area. If you're using those muscles and building those muscles, it's going to increase blood flow. So that'll help with lubrication, sensitivity, enjoyment. And then the things that you're using topically to help with the vaginal tissue are going to work even better, because you're doing your part with exercise, with building those pelvic floor muscles, and with continuing to engage in intimacy to help, everything to work at the best possible level that it can as we continue to age and mature.
And some things for men that will help is butt raises. Butt raises, when you put your feet on the floor and you lift your butt up to the sky. Butt raises. Another thing is leg lifts, but leg lifts when you lift your leg, open your legs, close your legs, lift your legs, open your legs. And that's a phenomenal lower abdominal exercise as well. But it works that works everything from the pelvis up to your midsection. Those are phenomenal exercises. Also, Kegel exercises too for men, which is, if you don't know what that is, when you go to the bathroom and you shut off your pee,
For women and men.
Right. When you shut off your pee, clench that muscle and shut off your pee, do that. That same.
Not when you're urinating.
Yeah, not when you're urinating, but
outside of
down.
urinating. But just remembering that feel and what those muscles do when you're doing that will make it easier.
Right, and it strengthens that area. You can feel it real good in that area between the I'm gonna say between the distracting.
Sorry.
In that area between I can't say it on here, but it's between your butt and your genital area, right? And you can feel it clenching in between that area, And then, that's where let me just explain this. And that's where what men don't know, your God, dog, I hate it on Facebook, but your penis it actually goes under your genitals and back a little bit further than that. That's why you can feel it down there, because when men say, "Well, I have a small penis," it's about 3 inches longer than you think. So, but it goes under that area, and you can feel that clenching in there when you're doing that. So, leg raises. Open your legs, close your legs, open your legs, close your legs. And that's a phenomenal lower abdominal exercise too. So if you're looking to, trim your waistline and get some of that belly fat, like I have the little tire right in the front here, that if I get rid of that, I'll probably be down about 225. That's phenomenal. And then the Kegel exercises where you feel like you're cutting off, when you go to bed and you cut off your pee, that's that same muscle that you're working like that. And that helps with blood flow, stiffness, longer erections, being able to control the erection as well. Because I think for men, it's not longer erections, it's being able to control the erection. Okay.
Be on demand.
Yeah, be on demand. Or no, keep it.
Yeah, and maintain it.
Yeah, not climax, immediately. Or at least slow it down,
Yeah, so you gave a lot more detail from me, and that was really, really good. But it made me think of a couple other things. Women, there are some Kegel balls that you can actually use that you can put in the canal, and then practice holding those in, and you can start with smaller and go up. So there are specific Kegel balls to help strengthen your pelvic floor muscles. And there are also medical devices, and we sell one of them that will help with the pelvic floor muscles and the blood flow to that area with the red light energy as well, with our VFit that we use and that our patients use who do intimacy procedures, or to help with the flow. So help with the blood flow. So it helps with the vaginal tissue, the lubrication, the sensitivity, and it also helps with the blood flow to the area in general with the red light and with the heat, and that's gonna improve blood flow and intimacy. So there's several other things that you can do to rebuild those pelvic floor muscles, which help with intimacy.
So I'm gonna take another pivot. All right. So because Ms. Cooper Carpenter brought it up, if you don't know, we specialize in hormone replacement therapy. And it is a life-changing, and we'll put her back up here. It is life-changing for a lot of people, including myself and Doc. But the one thing we realize is, you get your libido back, which if you don't know what libido is, go look it up.
Desire.
It is your desire. But you also have the energy to exercise.
Right.
That's one of the things that you gain, because you're losing energy and you're tired and you're exhausted during the day. So you're not gonna work out when you get home from work, and then you're gonna try to get all the sleep you can, because you're not sleeping. You're not sleeping all through the night
because your
hormones are off. So you're going in and out. And then if you have sleep apnea like me, it's double. Because not only am I waking up because of my breathing, I'm waking up because I'm not really sleeping well, So, but I don't do that anymore. I have no issues.
Get your pills
I get my pills and I sleep with my CPAP. So, So you don't have the energy. But now when you have your hormone replacement therapy, you have the energy to work out, you have the energy to do what you need to do during the day, because we're super busy individuals. We still cook, we still have family, we have a daughter that's super busy, so we stay busy. And then we have the energy to work out. I can tell you, when I ate that McDonald's stuff, it killed me. Yeah. It was like, we could not figure it out because we eat the same foods.
And then usually if it's some food that makes us sick, it makes both of us sick.
Make both of us sick. And I was like, I had that quarter pounder, but let me tell y'all, it was the best quarter pounder with cheese I've ever had in my life. The best.
But mindful eating is important, but that's also why mindful eating is so important. So pay attention to what you eat and how it makes you feel.
It was so good. I want one now. Look, that's how good it was.
No, you don't. Not the way it made you feel. But mindful eating is important because even though something may taste good, think about also how it makes you feel.
So let me tell you what y'all did.
If it's something that makes you feel bad, you probably should avoid it.
Right. So this is what I did. I went to the store. I went to the butcher, and I got me some meat from the butcher. And I'm gonna make my own quarter pounder with cheese. That's what I'm gonna do. I'm not gonna get it from the restaurant.
That means you can't have it. You're just gonna cook it with better quality,
better products,
food.
Better products. Better products. That's super expensive right now.
So let me pivot a little bit because it is Heart Month.
It's hard. It is Heart Month. And heart is very important to our family.
Yes, the number one cause of death in America is heart disease.
I actually had a grandparent died from heart disease or massive heart attack.
So making sure that you're doing the things that you can to make sure that you stay healthy and you protect your heart. So some of those things are knowing your numbers. So making sure you're maintaining a healthy level with your cholesterol, decreasing the saturated fats in your diet, increasing the unsaturated fats, taking the trans fats completely out. The leaner proteins going to be better for your cholesterol. Hormone pellets, actually testosterone replacement helps with your cholesterol numbers. Omega-3s, and we have a wonderful omega-3 in our line of supplements.
Ageless Balance
that help with
which we will be relaunching very, very, very soon. Go ahead.
Just because it's such a great line. But other things, decreasing the salt in your diet, decreasing the sugar and the processed foods in your diet, cooking at home more, exercising at least 150 minutes a week.
I had a question about salt. Go ahead.
Okay. And then making sure that you include some cardio activity as well as resistance training for your muscle mass. Controlling your blood pressure. If your blood pressure is over 125 over 85, you should be doing something, taking some kind of medicine to decrease it and keep your numbers normal. If you are a diabetic, keeping your hemoglobin A1C low as you can. And then monitoring what you're eating and how much sugar you're eating and how you're affecting your insulin levels with the foods that you choose. So all of those things are going to decrease your chance of getting heart disease. Those are controllable. Maintaining a healthy weight decreases your risk of heart disease. But what you can control is age. You can't control if you're African American. But what we do know is that hormonal balance is cardioprotective as well. So maintaining healthy hormone levels, even if you're only using testosterone, which is not contraindicated for anyone, that helps to protect your heart and decrease your risk of heart disease. So many things that you can do to improve your health, and of course, exercise. And then of course, having regular physical intimacy where you're getting your heart rate up and you're releasing those endorphins from the enjoyment that you can't get those endorphins from doing anything else. So making sure that you are engaging in regular physical intimacy, whether you have a partner or not, makes a big difference in your cardiac health. And even men who have a history of a heart attack can decrease their risk of having another heart attack by engaging in regular physical intimacy. Women who engage in regular physical intimacy actually live about 5 years longer than women who don't. So again, all of it ties together. To be healthy, to protect your heart, you have to live a healthy lifestyle. Exercise is included, and you need a healthy lifestyle to engage and enjoy everlasting intimacy forever, ever. So that was my pivot. Now you get another pivot. Heart disease, number one killer. Go to the doctor.
It's National Heart Month, right?
Yep, it's Heart Month. So go to the doctor, get your screenings. If you are over 50, you should be having regular cardiac screenings, which included EKG, echo, and some form of a stress test. and making sure that you see your cardiologist on a regular basis, see your primary care doctor, monitor your blood pressures. If you have high blood pressure, make sure you're keeping a log of your blood pressures to make sure that it's staying good, and check it at different times of the day. I always check it after you've rested for 3 to 5 minutes with your feet flat on the ground, not crossed. But don't just check it in the mornings or the afternoons or the evenings. Check it throughout different times, document the time so you can take that to your doctor so they can better manage your blood pressure medications.
And plus, the blood flow comes from what pumps the blood.
The heart. Weak
so.
heart, less blood flow. Yeah. The last place it's going to go is to the genital area. The first place it's going to go is to all of these major organs that you need to survive and live.
Right. So again, we're talking about exercising intimacy and how it plays a part in your intimacy and how you can have better intimacy because of exercise. I think it's just important that if you want to live longer, and here's the thing, if you want to be 80 years old and be able to be functional, it is important that you keep moving. You know, I think our good friend Darren says, move your numbers. You know, Daryl over in Dallas. What up, Daryl? He's worked with the National Heart Association for a long time. And you can find him on Instagram. He says, move your numbers, keep your numbers moving. So I think it's important that if you want to live a good 80-year-old life and you're moving around and you want to be able to get out of your house without assistance and things like that.
Functional,
and be functional, then, you know.
And have everlasting intimacy.
Yeah. I mean, you know, at 80, if you want to do that too, but I want to get out the house too. I want to be able to move around. I want to be able to travel. I want to, you know, be able to still drive my car, you know, and still have a good time, you know. So if you want to do that, I think it's important that you exercise, maintain a decent weight that's good for you, good for your health. And, you know, then possibly you can experience everlasting intimacy.
And remember, exercise also helps with your mood.
Right.
So and it also helps with your energy. So and your mental health.
So what supplements in our line do we have that help assist with you would say exercise? Well, not even exercise
or just weight management and muscle mass.
No, weight management.
Okay, so we have an adrenal supplement and we have a energy enhanced supplement. So for those people who are just so tired, they don't feel like exercising, that's 2 great supplements that will help with your energy so you can exercise. Right. The total or the T support, which is a testosterone supplement. It'll help with your muscle mass. It'll help with your energy. It'll help with your desire to exercise because it helps with mood. For some people, it's a mood thing. If you're depressed and very anxious, then you don't really have the energy to exercise. You just don't have the get up and go. So we have mood enhanced and we have mood and appetite that helps with emotional eating, and it has some serotonin in it to help you to feel better so that you mentally feel better so that you do feel like exercising. We have like the alpha lipoic acid and CLA if they control your insulin levels and help with your blood sugars, which is going to help with your energy. You know, so it's so many of them. The immune ones, you know, indirectly are going to help as well. But the ones specifically that help with energy, the ones, and on our website, you can actually go in and put what you need help with. If you have an energy thing, you can actually put it in there. It'll give you a few of the supplements, and then you can go look and see what's in them, and you can see which one is going to help most of those things. Or you can just schedule your appointment, do a total wellness consult so that we can figure out a good group of supplements that work for your specific needs.
All right. So, and our website is mibellawellness.com, and you can go to shop there and you can find all of our supplements. So lastly, Doc, what we got coming up?
Oh, we got a lot of good stuff coming up. So February the 8th, we have our webinar for the month, and it is on intimacy. So it's going to be for men and women talking about intimacy, all the different things that we can do to improve our intimacy, all the different services out there to help improve our intimacy. Of course, the total wellness component of making sure you can maintain intimacy. And then we're also launching our big event on March 15th that we're super excited about. The 4-play Ageless Vitality. pay attention to your social media tomorrow. Check your emails because you will get your link to go ahead and get those tickets early while they're early bird and cheaper. $50 off. It's going to be an amazing event on March 15th. And we are going to, it's a women's event this time, but we are going to move on and incorporate the men into our events. But this time it's a women's event and it's focused on intimacy, total wellness, living a healthy lifestyle. We're going to have some great experts, Dr. Sam, Dr. RJ, Dr. Michelle, Dr. Cree, of course, me, Dr. Tracy, and Coach Peggy Keebler, as well as Dr. Javara, who's going to be our intimacy specialist that gives us a lot of information on some other forms of intimacy that we can do without a partner. So it's going to be an amazing event, one of the first events that's truly focused on intimacy and intimacy in women and in the maturing woman, making us realize all the things that we can do to maintain everlasting intimacy is something I've been wanting to do. Is what my patients have been asking to talk about because everybody wants to know how to get through perimenopause and menopause and maintain great intimacy and be healthy, feel good, and live a really healthy lifestyle. So all of those things we will be talking about at my intimacy event on March 15th. It's called Ageless. It's the foreplay Ageless Vitality. It's going to be at the UAB Hilton, and you don't want to miss it. Listen out. We are super excited to be able to do it. The last time we tried to do it, COVID came, but now it is time.
We did it. It just
we did the foreplay, but then COVID kind of stopped our events in general. So we haven't done it again, but now we're doing it this year. We think it's a great time, and we think it's going to be very helpful for a lot of women to live their best lives in 2025, and they're on.
So be looking out. The foreplay, Ageless Vitality, coming up soon, and we do not have this on here. I don't know why we don't, but we have a podcast on YouTube called Ageless Vitality. We can talk a little bit freer on there because it's our podcast. So be looking for that. It's already out, 6 episodes already out there. We're about to record some more episodes, getting in some more greater detail, a little bit longer episodes to talk about some real life stuff too, not just everything me, Bella, which is we deal with everything, trust me, in our practice, but talk about some real life stuff, how we can be better partners, better in relationships, and just better at living life in general. So
individually, yes.
So thank y'all so much.
I know. We'll see y'all soon. Y'all have a wonderful, productive week. Live well, age well, experience everlasting intimacy. It's Dr. Mia and Joseph. We'll see you next time. Thanks for joining. Bye-bye.